I'm glad you could join us. Talking about going to the dentist is always fun, but there are new techniques that might be of value to you. Dr. Stanley Cho is with us right now. He is a dentist on Union Street in San Francisco. And the good doctor is talking about laser surgery. And Stanley, the idea of going to the dentist, first of all, you know, people don't rush in to see you because of your great personality. Is that right?
That's true.
Okay.
That's true.
But laser surgery is something that most of us don't really truly understand. I know it's used on the gums.
True.
Right?
Mm-hmm. What it is there's a small filament that is placed at the gum line, and it goes below the gum line and deep into whatever pockets have been made by the infection. And as it fires off, it will ablate or neutralize the bacteria and the toxins that they produce, which are mainly acids. And those acids are literally dissolving in a very, very slow way the bone tissue and all the soft tissue around the teeth.
That's when you go in and do an x-ray and they say part of your jaw is gone.
Right, exactly,
yeah.
Right.
Well, that happens as you age anyway,
though. No, not necessarily.
No?
No, not at all. If you're really good with your home care, you should be able to keep your teeth if you live to be 100. No problem. I have people in my office in their 90s with their teeth. So
my grandmother kept them when she was 90, but she had them in a glass.
Right.
Yeah.
Well,
there's a couple of ways of keeping your teeth.
A couple of ways of keeping your teeth, but we don't want to do. We don't want to do
Okay.
that.
The advantage of using laser surgery when someone has, let's say, gum infection and gum problems, over the older, more traditional method of using a scalpel, which gives you creeps to think about it.
Right. Most people.
Or what? I mean, it's less painful. It
absolutely
heals quickly. What kind of
all
things?
All the above.
Yeah.
Because when you, first of all, you don't open the tissues blatantly. It's a closed technique. It's somewhat similar to arthroscopy, for instance, when they place a camera and a little needle suction thing in your knee, and they only make 3 openings. They don't have to splice you open.
Yeah.
So it's the same thing here. The fiber is placed underneath the gum. When you're finished, the area is left sterile. Now, because the area is left sterile, the body does not have to send their troops, more or less, to the area, which would cause a lot of swelling and a lot of pain. So because the area is left sterile, there's very little discomfort. I've had patients go out and have dinner the same night. And the next day, I've had a patient go back to work the same day. Most people know that something was done the next day. The first day they might be fairly uncomfortable, but Advil or any of the ibuprofens can take care of that. They get a good
what
night's sleep.
what is the original diagnosis that calls for using laser surgery?
Well, the original diagnosis is really very simple: discoloration or redness of the gums. If you see blood on your toothbrush, if you see blood when you floss. Mobile teeth are an indication of an advanced case of periodontitis, but even those teeth can be saved. And basically, there's a certain amount of halitosis that goes along with that because the disease is caused by the same type of bacteria which produce the same acids, which have a certain amount of sulfur in them, and that sulfur smell is very, very indicative of periodontitis.
Okay, so if somebody has this problem with their gums and they can't decide what to do, I mean, how do you know? I mean, you're not the only dentist in town. You know, we know that. So if they go to their dentist and say, I would like to have laser surgery, do a lot of people do this?
I don't think the patient would say, I would like to have laser surgery. If they do, I hope they come to my office. But
yeah, right.
The dentist did probes. He has a little probe, and he places that probe between the gum line and the tooth, and that is an indication with the depth of that probing is what gives him a very good indication as to what's going on.
Okay, that's that's where you make the diagnosis.
And that's basically how it's diagnosed. But the trained technician, trained dentist can tell very quickly. If there's a problem.
All right, nice to have you here. Dr. Stanley Cho is with us. He's a dentist on Union Street, and we're talking about laser surgery. Thanks very much for joining us.